Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, I'm going to be covering infection, and this is going to be part one of a multi-part series on infection. Those that have been watching my burn series, part 3 is coming soon. I haven't forgotten about you. So I know you guys always ask in the comments what book I'm using, and depending on what I'm teaching about, I use several resources. But for infection, I'm using this book, Medical Surgical Nursing Patient-Centered Collaborative Care, 8th edition. And this is the author, if you guys want to get that book on Amazon or whatever, okay? So again, part 1, infection. All right, so let's get started. And I'll make this bigger so you can see. So we're going to start with transmission of infectious agents. Before we start, guys, you know you're going to like this video. Please support my channel by liking this video. Comment in the comment section so you can help out the algorithm and I show up more on your page. And don't forget, guys, you can find me on my other social media platforms such as Facebook, Instagram, and where am I on? Facebook and TikTok. All right. Every Sunday, 1 p.m. Eastern Standard Time, a new video is released where I actually cover questions on different subjects and I teach you how to answer the questions appropriately. All right, transmission of infectious agents. Look what it says. It says transmission of infectious agents require 3 factors. There has to be 3 factors present for someone who has an infection to be able to transmit it somewhere else, or for a patient to actually get that infection. 1, there has to be a reservoir. There has to be a source of the infectious agent. 2, susceptible host with a port of entry. How is that infectious agent going to enter into that patient's body? There has to be a port of entry. Is it through the respiratory tract? Did they have a cut in their skin and they was able to get in through their skin? Through an orifice of the body, there has to be a port of entry. And 3, mode of transmission. How does it enter the body? Okay, so let's go over it. First, the reservoir, the source. Reservoir sources of infectious agents are numerous. Animate reservoirs include people, animals, and insects. These are living things that can transmit infections. What about non-living things? Inanimate reservoirs include soil, water, other environmental sources, and medical equipment, which is why it's so important, guys, especially if the patient's getting an invasive procedure, that medical equipment be sterilized. Anything going into a patient's body, if it's invasive, it has to be sterilized because you can introduce that bacteria, that virus, that pathogen into the patient's body through equipment. Stethoscopes used for auscultations by many healthcare providers carry staph from the skin of one patient to another. When you go from room to room, you're using that stethoscope. You need to be wiping down that stethoscope each and every time. These devices should be cleaned with an antibacterial solution between patients so you can stop the spread of infection. Make this bigger for you. Okay, I think that should help. The host body can be a reservoir. Pathogens colonize skin and body substances such as your feces, your sputum, your saliva, your wound drainage. A person with an active infection or asymptomatic carrier, which means they have those pathogens, they have that bacteria, they have those viruses, but they're not showing any clinical manifestations, but they're still carrying it around. That's what they mean when they say asymptomatic carrier. A person with an active infection or an asymptomatic carrier, one who harbors infectious agents without the active disease, is a reservoir. Let's take a look at immunity. A second, guys. Immunity. Immunity, this is the resistance to infection. It's usually associated with the presence of antibodies or cells that act on specific microorganisms. And there are different types of immunity. I put a star next to them because it's very important. You have to know those different types. Passive immunity, this is of short duration, days or months. And it's either natural by transplantal transfer from the mother or artificial injection of antibodies. So passive immunity, the body's not doing anything to build up their immunity. They're getting that immunity. That's why it's called passive immunity. And so a great example is the newborn baby that's born. And so they have some immunity because they got the antibodies from the mother, or an injection of those antibodies. Okay, that's passive immunity. Now let's take a look at active immunity. Active immunity works a lot, it lasts a lot longer, and it makes sense because the body was actually working for it. Active immunity lasts for years, not days, not months, for years. And is natural by infection or artificial stimulation of the body's immune defenses, such as vaccination. Do not confuse vaccination for passive immunity. Vaccination is active immunity. Here's why. When you get a vaccine, you get a very diluted, minute amount of whatever that virus is, and it makes your own body produce its own antibodies. So your body producing those antibodies, your body working, is active immunity. Okay, or you getting sick, you getting the flu, you getting a cold, you getting infected with whatever bacteria. Now your body recognizes this bacteria, this virus, this pathogen, and so your body makes its own antibodies to fight them next time we see them, right? That's active immunity. And vaccination is a great example of an active immunity. Environmental factors can also influence patients' immune status and their susceptibility to or ability to fight infection. What are examples of those environmental factors? Alcohol consumption. Do you think alcohol could increase or decrease immunity? Decrease. Nicotine use, decrease. Inhalation of bone marrow suppressing toxic chemicals, decrease immunity. Remember, guys, your bone marrow, that's what makes important cells such as your RBCs. RBCs carry hemoglobin. Hemoglobin carries oxygen so everything can be perfused in your body. Bone marrow makes your platelets so you can clot and not hemorrhage to death. Bone marrow makes your WBC so you can fight off infection. So of course, if the person is taking some type of, or being exposed to some type of toxic chemical that can decrease or suppress their bone marrow, that's going to depress the patient's immunity. Absolutely. Certain vitamin deficiencies. Easy one, the first one come to my mind is what? Vitamin C. Vitamin C helps you fight off infections. So if the patient has a deficiency of vitamin C, absolutely that can make them more prone to infections. Malnutrition, especially protein calorie malnutrition, places patients at increased risk of infection. Guys, when a patient has an infection, what do we make sure we give them lots of? Protein. Why? Protein helps with infection. Protein helps with wound healing. Diseases such as diabetes absolutely predisposes people to infections. Being an older adult, that can predispose you to infections. Wear and tear of the body. Okay, those systems, those defense systems aren't working the way they used to. Take a look at, let's see if I can move this. You need to know this. Host factors that influence the development of immunity. Again, guys, you need to know the different types of immunity. Host factor, natural immunity. Remember, it could be congenital where the baby got it from the mom, or it can be acquired where they actually get an injection of those antibodies. Normal flora, that's alteration of normal flora by antibiotic therapy. So guys, there's certain bacteria in your body that is normal, that actually protects you. You have normal flora. If you're female, you have normal flora of the vagina. And so if you're taking antibiotics, you're douching or you're soaping down there, you're killing the normal flora that actually protects that the mucous membranes of the vagina. Guess what happens? You can get a yeast infection. Again, age, the older that you get, is just wear and tear of the body, places you more at risk. Hormonal factors, diabetes. Let me put 2 stars next to this. Diabetes. Corticosteroid therapy. You guys know that any patient that's on corticosteroids, the first 3 things that you need to be concerned about is 1, infection, because remember, it decreases inflammation and masks the signs and symptoms of infection. So when the patient's taking steroids, you better be thinking of infection. You better be thinking of fractures. And what's the third thing? Steroids, infection, fractures. Oh, and you better be thinking of hyperglycemia. So yes, patient taking steroids, that is a factor that can decrease the patient's immunity. And of course, adrenal insufficiency. Remember, the adrenal glands, that's what shoots out those hormones, fight or flight, to help you fight or flight from that infection. And then here are the other ones. I'm not going to read them all, guys. You can read this on your own. Make sure you know and understand these factors that can affect the patient's ability to fight off infection. Factors that may increase risk for infection in the older patient, obviously their immune system. Remember, the immune system is what helps you fight off infection. The integumentary system. Your skin is the first line of defense against pathogens. So if that is compromised, then you're going to be more at risk for infection. The respiratory system. If you're not deep breathing the way you're supposed to, you're not moving around, your lungs aren't expanding, you're at risk for what? Pneumonia, other infections, and the list goes on. Make sure you guys read that on your own. These are important factors for you guys to know for the older adult. Try to make this bigger for you. Okay, medical and surgical interventions. I already explained that. Absolutely, that's going to place a patient at risk for infection. Anytime there's an invasive procedure, anytime that something foreign is going into somebody's body, there's a chance of introducing pathogens and giving them an infection. Steroid therapy, I already explained to you. Remember, steroids decrease inflammation, but they also mask the signs and symptoms of infection. So any patient that is on steroids, you have to watch them much, much more closely, because it's going to take longer for them to develop a fever and inflammation and those signs and symptoms that we normally see of infection. Patients on steroids, you better be thinking fever. You better be thinking infection, fractures, and hyperglycemia, because steroids are very sugary. It's going to increase a patient's blood glucose. Medical devices, things that you're using on the patients, you can transfer infection from one person to another if you're not cleaning them and wiping them down. Surgery, trauma, radiation therapy, burns result in non-intact skin. Let's stop right there. The fact that we know that all of these can cause the patient to have non-intact skin, and we know that the skin is the first line of defense when it comes to protection from infection, we know all of these things listed can cause the patient to have an infection. The body skin is one of the best barriers against the, infection. Routes of transmission. How are these infections spread? Through the respiratory tract. Microbes in droplets are sprayed into the air when people with infected oral or nasal tissues talk, cough, or sneeze. So they talk, cough, or sneeze, and those infected droplets are floating in the air, and then the unsuspecting person walk right by, and they breathe in those infected droplets, and now they're infected. Other pathogens enter the body through the GI tract. And they give you some examples. Millions of foodborne illness cases occur each year in the US. So the infectious agents could be in the food and then the person eats them. The person handling the food, that's making the food, went to the bathroom, didn't wash their hands or didn't wash their hands correctly, came back and fixed your food, and then you ate that food, right? Microorganisms can enter through the genitourinary tract. You know you're supposed to wipe front to back, you forget, and you wipe back to front, and those pathogens that were in the rectal area, E. coli, right, now is around the vaginal area, and those pathogens creep up to the bladder. Now you got a bladder infection. Although intact skin is the best barrier to prevent infections, some pathogens, such as, I'm not going to try to pronounce this one, but you see it, it can enter the body through intact skin or mucous membranes. It can just be absorbed. Microorganisms can gain direct access to the bloodstream. And that's the worst one, guys, because guess what? That blood is going throughout your entire body. That can cause a patient to have a septic infection, which is very serious. Reducing catheter-associated urinary tract infections. Remember, guys, I told you anything introduced into the body, you placing that patient at high risk for infection. So we do not put catheters into patients unless it's absolutely necessary. And the minute it's possible to safely remove that catheter, we're going to do it, because the risk is so high that we give them infection because we're introducing that foreign body into an orifice. This has been seen on NCLEX many times, so it's very important for you guys to understand this this content. That's why I put an NCLEX next to it. Look what it says: commentary, implications for practice and research. Research demonstrates that decreasing the use of indwelling catheters is, do I have a highlighter here? Yes, I do. Look. Not important. It says the most important, as in number one, as in priority, the most important intervention to prevent hospital-acquired urinary tract infections. Methods of transmission. Methods of transmission. So there's contact precautions. Let's start with contact transmission. This is a usual mode of transmission of most infections. Many infections are spread by either direct or indirect contact. So direct contact. With direct contact, the source and host have physical contact. When I say physical contact, they're actually touching that person. There's physical contact, okay? Indirect contact, transmission involves the transfer of microorganisms from a source to a host. Look at this, by passive transfer from a contaminated agent. Contaminated articles or hands may be the source of infection. And they give you an example. So for example, patient care devices such as a glucometer and electronic thermometers can transmit pathogens if they are contaminated with blood or body fluids. They weren't wiped down. Uniforms, laboratory coats, isolation gowns used as part of personal protective equipment can be contaminated as well. You see the difference? Well, I didn't give you a difference for the contact precaution, so let's go up here. Look, it says microorganisms are transferred directly from skin to skin or from mucous membranes to mucous membranes. It's often called person to person because they're actually that contact is direct. Does that make sense? Direct contact is best illustrated by the spread of the common cold. Lots of important stuff on this page. Look at this. Indirect transmission may involve contact with infected secretions or droplets. Something important for you guys to know. The word droplets, when you hear droplets, I want you to know those are the larger particles. They're 5 millimeters or greater, okay? When we're talking about droplets. Droplets are produced when a person talks or sneezes. The droplets travel short distances. Therefore, the CDC recommends the staff stay at least, look at this, 3 feet away from a patient with droplet precautions. An example of droplet spread infection is the influenza. Now let's talk about airborne. Airborne transmission occurs when small airborne particles, and when I say small, I'm talking about less than that 5 millimeters. When small airborne particles containing pathogens leave the infected source and they enter in a susceptible host. These pathogens can be suspended in the air for a prolonged amount of time. And guys, when I say prolonged amount of time, I'm talking about hours. Hours. It can be spread through the respiratory tract by coughing or sneezing. And a perfect example, and this example actually the NCLEX uses a lot, tuberculosis. Okay, tuberculosis is spread via airborne transmission. Preventing the spread of microbes that are transmitted by airborne route requires the use of special air handling and ventilation systems. For TB, tuberculosis, which we just talked about, we know it's airborne. Varicella, that's the chicken pox, also airborne, guys. These are examples of airborne agents. You need to know that. These are examples that are famously used on test questions. This is the type of mask you're going to be wearing for the airborne precautions. N95. It has to be fitted for your face. Vectors are insects that carry pathogens between 2 or more hosts, such as the deer tick that causes Lyme disease. So vectors can be a mosquito that carries a bloodborne pathogens. Okay, so vectors are animals, they're insects that carry infections. The portal of exit completes a chain of infection. Exit of the microbe from the host often occurs through the portal of entry. So if the person got the flu through breathing it in, they most likely will give someone else the flu by them sneezing or coughing, and then someone else gets it the same way they got it. That same portal of entry is usually the exit, okay? Physiologic defense, I'm sorry guys, this is so small. Physiologic defenses for infection. I'm going to stop right here. And the reason this video is so short, I actually have an appointment I'm about to be late to, but part 2 is coming up. And for those that were following my burn series, part 3 for burns will be coming to you shortly. Please guys, don't forget to like this video. In the comment section, let me know what you thought about this video. Let me know what you would like to see me cover next. Don't forget, I have audio lessons available for you on my website, nexusnursinginstitute.com. And you guys can also catch me on my other social media platforms, such as Instagram, Facebook, and TikTok. Thank you for watching this video, and you guys will see me on the next video.